Good evening, everyone, and welcome to the Canadian Concussion Center's webinar series sponsored by LiUNA, the Labor's International Union of North America. My name is Leslie Rattan, and I'm pleased to be moderating our ongoing webinar series that was developed for individuals that have suffered concussions, their caregivers, healthcare providers as well. And if you've been with us before, you know that the sessions are recurring every other Tuesday evening, same time, 6 p.m. and Eastern Standard Time. And just so that you know as well that all of the sessions are recorded so that you're able to view them on the Canadian Concussion Center website. And I believe Christian has just very kindly put the link in the chat if you want to copy and paste that. So for this evening, if you haven't been with us before, if you look to the bottom of the Zoom screen, you'll see a Q&A. If you have any questions for our speaker tonight, that's where we would ask that you type them. If you have any technical difficulties, just put those into the chat and Christian will help you out. So also, Christian, I believe we'll be putting the PDF of the presentation for tonight into the chat as well. So just before I introduce our guest speaker, we're just going to run a quick poll as we do each week, just to get a sense of who is in our audience. So if I can get Christian just to put that up. Here we go. We'll just give people a second. Great, thank you very much. So for this evening session, I'm really pleased to introduce Dr. David Gold, who we have with us. Dr. Gold is a staff psychologist at the Toronto Western Hospital. He provides neuropsychological consultation for the epilepsy program primarily, as well as other divisions of the Krembil Brain Institute, such as the Canadian Concussion Center. Dr. Gold is an assistant professor in the Department of Psychiatry at the University of Toronto and enjoys teaching and supervising clinical psychology trainees. His doctoral and postdoctoral research examined event cognition and the cognitive neuropsychology of aging, while his current research interests include questions about the cognitive neuroscience of memory and the intersection of neurology and psychiatry, such as ADHD assessment and treatment. So with that, I'm going to turn it over to Dr. Gold for his presentation.
Okay, thank you for the introduction. So I am really pleased to talk to everyone tonight about neuropsychological assessment in persisting concussion, and we'll have lots of time for questions at the end. And so with that, let's get started. So to start with our learning objectives, I thought it would be helpful to talk a little bit about how various regions of the brain contribute to thinking skills. So how do we go from a brain, which is an organ in our body, to the ability to think? And then talking about how a brain injury can impact those thinking skills. So talking a little bit at the level of neurons, what happens in a brain injury and how does that impact thinking skills? And then next, how do we evaluate thinking skills in neuropsychology? So Dr. Rattan and I are neuropsychologists, and we're going to give you a little peek into how we evaluate thinking skills in neuropsychology. So as an overview, we'll first talk about neurons and major brain regions. Then we'll talk a little bit about how brain injury can impact thinking skills. And then we'll end with discussing, how do we evaluate those thinking skills in neuropsychology? So there'll be 3 parts to the talk tonight. So what is cognition? Well, starting with the brain as being the way we kind of think about our anchor for cognition, the front part of our brain, or the frontal lobe, is involved in this type of thinking called executive function. And so executive function is a fancy word for talking about the CEO of the brain, or how we are in charge of thinking skills, how we regulate other sorts of thinking skills, being mentally flexible, decision-making. So a lot of thinking abilities come from the frontal part of our brain that go into executive function. And so I think of it as being like the executive of your brain, like the CEO. And in the back of the brain, our occipital lobe, that's involved with seeing. So that's involved in vision. And then towards the back, but not completely, is the parietal lobe. One easy way to remember what it does is to think of more visual spatial skills, like finding your place in space. And then the temporal lobe is a very diverse part of the brain, and it's involved with memory and language. So that just gives us a little bit of landmarks to think about cognition. And so how does our brain produce those different types of cognition? Well, one thing our brain does is we have neurons that talk to each other. And so those are the main ways that we think, is through the neurons communicating. And they communicate at the level of an electrical signal, but also at the chemical level. When we think about neurotransmitters talking to each other, they're transferring from one neuron to another neuron. And so when we think about neurotransmitters, they're a way for our neurons in our brain to talk to each other. And they can talk to each other more quickly using an electrical signal. So they communicate with electricity and as well as with neurotransmitters. And when we think about a single neuron, they talk to networks of neurons. So neurons are talking to each other within this whole bundle of networked activity. And over the course of our brain, we have different regions that are talking to each other as a network. And some of those regions are more specialized for different types of thinking. And that's how we get different types of thinking skills more associated with different parts of the brain. And so when we think about cognition, it's not a single neuron, but it's a network. And so one good analogy is to think about the internet and networks of activation. And so we go from these networks of activating neurons to different regions that might be more important for thinking. So the executive function part of our brain is more the front part, and that's a particular network of activation. And maybe it talks to the temporal lobe, which is more involved in memory, or maybe it talks to the parietal lobe, which is more involved in visual spatial skills. And just like a conductor kind of conducting this orchestra, we need these networks to be talking to each other in a very fluent way, or else it can seem chaotic. And so when we're thinking about networks of activation, we really need a conductor in our brain who's telling all the different parts of our brain, when's it time to stop thinking, when's it time to activate a different part. And so I like to think of it like an orchestra with a conductor telling different parts of the brain when to be active to help for really smooth, efficient thinking skills. And so what happens if we disrupt that flow of information? Well, unfortunately, in something like a head injury, we see that the brain can actually collide with our skull. And so the brain moves within our skull, and we can see injuries to the front part of the brain or the back part of the brain. And then we can see the injury from the brain trying to kind of replace itself within the brain. And fancy terms for those are coup and contra coup injuries. But one way to think about the injury is that the neurons in our brain are then disrupted in terms of their activation. So that beautiful network that requires this conductor to properly get the different parts of the orchestra playing, well, when we have a brain injury, sometimes we can see disrupted communication between those neurons. And so with very serious injuries, we can sometimes see that the neurons actually get pulled or stretched or torn. So that would be a primary damage to neurons, and that could show up in an MRI, for instance, as being a site of inflammation or damage, or sometimes called a hemosiderin deposit in the brain. But more commonly, we would see secondary damage in the brain from neurons that are damaged in terms of at the level of the neurotransmitters, so the way neurons talk to each other, at the level of inflammation in neurons and the cells that support them, in the metabolism of neurons, so how they kind of use energy and talk to each other. Also at the level of physiology and kind of breaking down different byproducts of brain injury. And so more commonly, there's secondary damage from concussive injuries that are causing trouble with our neurons. And so we go from the level of neurons having disrupted communication to the level of different parts of our brain having different kind of disrupted communication. It leaves us with changes in these thinking skills for some people. And so there's not one particular type of thinking skill that's impacted in brain injury. Sometimes people say, wow, I feel it's really tough for me to sustain attention. And that takes a lot of different parts of our brain to sustain attention, but part of our frontal lobe is involved in sustaining attention. We could feel like our whole brain is reduced in its thinking speed, kind of like a computer that isn't functioning as well. So the neural communication is slowed down. Sometimes people report back to me and they say, I just can't pay attention or think for as long as I could. I was previously able to maintain attention for an hour, and now it's reduced and it's only 30 minutes or 20 minutes. Another type of challenge people can note is learning new information, especially when it's not organized for them. And so that could be something related to the temporal lobe in particular. Sometimes people say, well, it's really hard for me to focus on two tasks at the same time. So that would be a complaint related to multitasking. Sometimes it's finding the word you're looking for to express yourself. That could be another type of thinking that's impacted. And sometimes it can be mental flexibility, like changing your plans when you need to, or responding to feedback in a flexible way. And so these are all the different types of cognition that can be impacted. And so there's not one type of cognitive complaint that some people report after a head injury, but these are some of the more common ones. And so when we think about which part of the brain is most commonly affected, it's most typically the frontal lobe. And so that's the part of our brain that's involved with executive function. And so I put up this little cartoon of a CEO, and thinking about executive function, she may have to focus on two tasks at the same time. Or maybe she has to respond to what someone is asking her and putting a report in her face and saying, tell me what you think of this report, or answering the phone while still thinking about another thing. And so executive function refers to that mental flexibility of doing all of those tasks at the same time or in order, making a plan, being mentally flexible. And a simple way to think about that is that that's more involved with the front part of our brain. But we know that it's actually even more brain regions than just the front of our brain, but it's helpful just to think about it as the front part of our brain. And so to pull you into behind the curtains of what we do in neuropsychology, I thought it would be helpful to go through some of the tasks for how we assess thinking skills. And so here are some examples. So maybe we say to ourselves, well, we want to measure reasoning and problem solving with one of our clients. And we ask our client, well, here's some patterns. And up here, we want you to tell us which pattern below best completes the whole pattern above. So that could be a type of reasoning involved where you have to kind of guess or predict which one of the patterns below best completes the matrices above. We might ask you a verbal reasoning question where we might say, okay, what does the expression mean, a rolling stone gathers no moss? So being able to abstract and reason is a type of executive function. We might put up a maze and say, okay, what's the most efficient way to solve this maze, to go from the beginning to the end? And people are having trouble with their thinking skills. One of the things they notice is that maybe they're not able to form a plan as efficiently, and they might get blocked or stopped more often. And so that could be a type of thinking skill. We might ask you this working memory type of problem where we say, okay, if a train leaves at 7 a.m. from Oshawa, traveling at 90 kilometers an hour for 110 kilometers to Mississauga, when will it arrive? And so you have to keep information in mind. You have to solve it using a mathematical operation. And so that's a type of reasoning and problem solving. We might also be curious about your attention span, or how many things can you pay attention to or hold on to before it disappears for you. And so maybe we might make these crosses disappear. And we might ask you, okay, do you remember which order they went in? And we'd say, okay, was it the yellow one that came first, or was it the red one? And so that's an example of measuring attention span. Another could be working memory, where we say, okay, we want to see how many of these digits can you hold on to in working memory. And maybe if I'm feeling particularly sinister, I might say, okay, I want you to subtract the difference between the numbers and then keep adding them to the next number as they're going along. And so that could be an example of testing. Can you work with things in your working memory before they disappear? And it's challenging and frustrating. And if we're having trouble with our executive function, that could be a way that it comes out in our testing. Another type of thinking skill that we could look at could be this multitasking. And so we might ask you to do two things at the same time in this task. So for instance, we might say, okay, I want you to circle all the red things on this paper. Or we might say, I want you to circle all the triangles that you can find. Or we might say, I want you to switch between going to numbers and a shape. Or we might say, I want you to try to cross off all of the different letters, just the letters. And so when we're having you do two things at the same time or switching, we think of that as a measure of multitasking, which is a type of executive function. Another type of executive function could be this task where we say, okay, I want you to find all of the bold numbers, or I want you to find all the numbers that are in that are fives, and we might switch the rules on you. And that's really a way of kind of testing what is your complex attention when you have to search through this visual array and identify a particular type of target. It could be numbers, it could be bolded numbers. We have different ways of trying to keep you on your toes mentally. Another type of thinking skill is a game that kids play where, for instance, they have to clap every time they hear a particular target. Let's say it could be vegetables, but they have to not clap when someone says a different type of target, such as a country. And so I could read a long list to you and I'd say, okay, everyone, I want you to clap every time you hit the target and don't clap when you don't hear the target. And I've tried it before, and because of internet and lags, it doesn't work so well. But hopefully you get the idea that we're testing the ability to mentally hit the brakes or to not clap when you're not supposed to as a way of testing how is that executive function or mental flexibility. Are you able to hit the brakes mentally when you need to and to activate when you're supposed to? Another type of thinking skill is processing speed. So that's a type of skill related to how quickly your neurons are talking to each other. And we might say, okay, whenever you see that green square, I want you to go. And whenever you don't see it, we want you to wait. And so we just see how quickly can you hit the space bar every time you see that green is go. So that would be a test of pure reaction time or processing speed. Another type of thinking skill that's really important to assess is memory. And so whenever I meet anyone new who talks to me about memory, I always say there's three parts of memory. There's encoding, or getting things into memory. There's storage, or holding on to things in memory. And then there's the retrieval part of memory, or getting things out. And so memory can be affected in three different kind of parts. And so when we think about concussion and which type of memory process can get affected, it's often encoding as well as retrieval. And so sometimes it can be harder to learn new things, which is encoding, and sometimes it can be harder to get things out of memory, which is retrieval. So how do we measure that in the clinic? Well, we could give you a learning test where we say these words or have you read these words: ukulele, platinum, violin, bronze, cleats, boots, saxophone, loafers, tin, silver, drums, sandals. And then I might say, well, okay, tell me all the words that you can remember. And we might do it a couple times just to see how many words you learn with more exposure to those words. And so that would be a test of memory where we're seeing how many words can you recall. And then we might ask you, were some of the words on the list? Do you remember, was tin on the list? Was accordion on the list? Was sandals on the list? Was trumpet on the list? And so when we're testing recognition memory, we're seeing if you can recognize the words, which is easier than recalling it because we're helping you out and saying was the word there? It's not just up to you to remember, was the word there? And so that's a way of testing memory. And usually recognition memory is better than our recall. We may also test memory by seeing how many visual designs can you learn. And so here are some visual designs here, and we might show them to you one at a time or all at the same time. And then we might say, okay, I want you to try to draw as many of those designs as you can remember. And if I'm feeling particularly mean, I might say in the exact same place they were on the grid. And then we might ask you, okay, was this the position that the items were in? And see how many you can recognize. Another type of thinking skill we call word finding. And so this is a type of language ability. And we might show you some items and they might be relatively common. And we might say, okay, what do you call this thing? What's the name for it? And I always like to ask people, especially people younger than me, what do you think our next neuropsychology tests are going to be like? And I thought, well, maybe there could be this neuropsychology test where I show emojis and I ask people to try to decode what it means. And so I say that partly in joke, but we're using emojis so much that I wonder if it's changing the way we think. So what are the nuts and bolts of our neuropsych assessment? We usually start in our clinic by understanding, what have you noticed in your daily life? How has this affected you? What kind of thinking skills have you appreciated as changing as a result of a head injury? We might ask you to kind of comment on, has it affected your work? Has it affected your ability to do things around the house? How have you noticed your thinking skills? And then we might test all of those cognitive domains that we just reviewed together with these paper and pencil tests and some on the computer. And then we'd give you feedback to say, well, what areas are stronger, what areas are weaker, and what does that mean for our particular referral question, usually back to family doctor or your neurologist. And then what are some potential strategies that could be helpful based on your unique pattern of strengths and weaknesses? And so what we do is we compare you to yourself as well as to the general population, and we find out which scores are normal, which are abnormal, and it gives us a sense of strengths and weaknesses. And then we get an individual profile of what people's particular cognitive strengths and weaknesses are. And in this hypothetical example, this person's got really strong memory abilities. They're above average. They've got weaknesses in attention. Those skills are below average. They've got weaknesses in executive function. Those are below average. And so that would be their own personal pattern of strengths and weaknesses. And so with our neuropsychological approach, we start with that comprehensive interview that we talked about. And we try to choose tests that are based on our hypotheses about what might be affected based on your brain injury. So we might choose that attention test, the visual spatial test, that complex attention test, the learning test. And then we will take some of the information from your medical background, things like MRIs or EEGs or your blood tests, things like that. And we try to say, well, how does what we know about your thinking skills fit in with the other medical information in your health profile? And to see if that fits with what we know in the thinking tests. So some common challenges that we face are that, sometimes we have people with different cultural backgrounds. And so we have to use sometimes tests that are more customized for different people from different backgrounds. Sometimes people have very strong baseline abilities. We have to pull out our hardest, most challenging tests because their performance is expected to be really high. And so we need to make sure we have really challenging tests. Sometimes people are tested and they only do one small brief test in their family doctor's office, and so we have to kind of help accommodate for people only having one test, and we use multiple tests where we test the same ability over time. And so we're able to interpret it when we do tests over and over again, to repeat and expect to see things like how well someone would do if they did the same test twice, what that could mean. And we're also in a good position to understand, well, if someone's having challenges with their mood, how is that impacting thinking skills? And so we have tools and techniques that allow us to understand, well, could this kind of pattern of performance be better explained by things like depression or anxiety, or is it more consistent with something else? And so that was a little overview of how we handle some of those challenges. We might interpret some tests using an interpreter. We might choose challenging tests for people with a high baseline. We might use tests that are similar in order to make sure that we didn't just catch you on one test at a bad moment. We might try to interpret tests that have been done multiple times in specific ways. And we have ways of testing mood to really better appreciate what is the role of mood in your cognitive profile. So to put it together, we're kind of being able to help diagnose what sort of challenges people are having with cognitive strengths and weaknesses. And we're able to kind of comment on if there's secondary factors that might be impacting thinking skills, things like poor sleep or side effects of medications. And so we're also able to say, well, here's things that could be helpful. So maybe it's helpful to try to approach learning in a different way, or maybe it could be helpful to learn particular organization or strategies that help you when you're feeling distracted, or to try an approach like mindfulness to see if that could be beneficial. So we're able to help with making recommendations that could be helpful. So I know that was a quick overview of the world of neuropsychology, but I wanted to make sure we have a lot of time for our discussion if people are curious. And so I will turn it back to Dr. Rattan.
Great. Thank you so much, Dr. Gold. That was excellent. Really, really great summary. And we already have a number of questions. Let's see. I have had numerous concussions and I recently started doing a lot more walking. When I am walking laps around the mall, I am fine. But when I'm walking laps around the house, I start to get dizzy after a couple of rounds. Any idea why this might happen?
I'm not sure. It could be what's capturing your visual attention, that it's more challenging to integrate, or something about balance. I don't know. Do you have any thoughts, Leslie?
I don't know. I was wondering in terms of the mall, I just, it would obviously be a larger, more roomy space, whereas I'm wondering if in your home, you're going in smaller circles where that might be more apt
Yeah.
to make you dizzy.
Yeah, you might be making more turns per minute, and
Yeah, exactly.
maybe going up and down is also disorienting for your visual system.
Yeah.
Whereas a mall's a flat surface, unless it's a kind of a very futuristic kind of tower mall.
Yeah, yeah, exactly. Um, And just a reminder to everyone, if you can put your questions into the Q&A. Sandy's asking, do you release the results of the neuropsychological evaluation to the patient or just to the person who ordered this test?
That's a terrific question. And I would say that you are entitled to your health record. And so it should be presented to you in a way that you can understand, and you should get a copy of your report. And so it's not a mystery. And just like being able to see your MRI using apps like MyUHN, your neuropsychology results are part of your health record, and you absolutely should have access to them. And more importantly, I think it's helpful to talk to the neuropsychologist to find out, well, what is your feedback about these results? And so, results that are in two different people's hands could be interpreted differently. And so it's really important for you to have the opportunity to ask questions about your results, find out what they mean for you, and find out how that impacts your care or recovery.
Yeah, great question. Lynn asks, as MRIs do not show post-concussion syndrome, are functional MRIs ever used instead of standard MRIs?
That is a great question. And so I'm going to explain a little bit about functional MRI just to be able to get everyone on the same page. And so a functional MRI asks the question of, while you're inside an MRI and you're doing a task, can we see different patterns of activation in the brain based on what you're doing inside the MRI? So a standard MRI is structural and you're not doing anything. Usually you're just closing your eyes and they'll ask you not to move. But a functional MRI, we give you a task during it and we'll ask you to kind of be thinking, so we see different parts of your brain activated. So an example of a functional MRI we do at the clinic is we'll ask you to do a language task, and we'll say, okay, I want you to think of all the words you can that start with a particular letter. Or I want you to think of all of the action words that you can think of when I show you a picture. And the reason we do that is that it makes the language parts of your brain more active. And we see that because there's more oxygen going to those parts of the brain. And so we're seeing how the brain functions during a thinking task. And so that can be a helpful way of understanding brain activation. And so we use that in our epilepsy clinic as a way of seeing which side of the brain is more involved in language. But to the best of my knowledge, there aren't really any clinical tests for concussion where we can say, relative to someone who hasn't had a concussion, this is the way they're activating on that task in order to either validate that this person has truly had a concussion or to kind of comment on their recovery. So to the best of my knowledge, it hasn't been used as a clinical test the way an MRI has, but there are certainly research findings that indicate that with conditions like concussion, there are different patterns of activation that some individuals will show. And so it's a way of appreciating that the brain functioning is different, even though the structural appearance of the brain may not be.
Great, thank you. And another MRI question.
Okay.
How does inflammation show in an MRI? I thought a concussion doesn't show, question mark.
Yeah, so we can see encephalomalacia. We can see areas of kind of more acute swelling in the brain as a type of inflammation, but more subtle forms of inflammation might not be visible. And so there are some inflammatory biomarkers. So when people have things like cardiac conditions, we can look for particular biomarkers of a cardiac condition in someone's blood work. And there are some kind of neural markers of inflammation that we can look at as well. But in general, our standard MRIs wouldn't necessarily be sensitive to subtle forms of inflammation, but rather larger, more visible forms of inflammation.
Great, thank you. Next person is saying, I have a lot of word finding issues. It drives me crazy. Any tips on improving this?
Yes, yeah. So I've talked to speech language pathologists because they're the experts in this area. And I say, pretend like I'm one of your patients who has word finding difficulties with concussion. Take me through what you would do. And so she said to me, the first thing she does is that if you're having trouble finding the word you're looking for, don't panic. Don't get frustrated. Don't try to kind of squeeze as tight as you can and put pressure on yourself, but try to relax. Because one thing that works against your thinking skills is this sense of pressure. So if someone's yelling at you or you're trying to rush, our thinking skills aren't as good. So she said, first thing to remember is relax. So to the best of your ability, take a deep breath and say, it's okay. I can just rest in my breath for a second. It's okay that I can't think of this word. I'm going to try to be calm. So we try to be calm. And she said the next thing is she recommends a strategy where you go through the alphabet and you try to see, could a letter of the alphabet cue you to the word you're looking for? So, I'm thinking of a particular word and I go through A, B, C, D. So I'm silently going through the alphabet, seeing if that helps cue me. The other thing she recommends is thinking of words that are similar. So maybe if you're trying to think of the word champagne and it's a hard word to come up with because it's infrequent, you think of similar words like bubbly alcohol or alcohol that comes in a bottle that pops, like something where you're describing the word. And so one thing that does is it helps cue information that's nearby. And so because our knowledge is kind of organized in a particular way, like branches of a tree, saying those things can actually help to cue you, and you eventually remember the word is champagne I'm looking for. And so those are some examples of things that she's given me as strategies. The one other thing is visualizing. So she said sometimes visualizing the word where you kind of try to picture it in your head and can be helpful, but sometimes that can also be frustrating because maybe you're having trouble finding the word because you can picture it in your head and visualizing doesn't get you closer to it, but sometimes it can be helpful. Any other ones come to your mind, Leslie?
No, I think that probably covers it. Yeah,
Yeah.
yeah,
Yeah, it is frustrating. And
yeah.
so I just encourage people to be patient. And so sometimes that it's the word, it's like the librarian in our head is looking for the word in the library and she just can't quite find it. And then later on it comes to her. So I encourage people to think about it as just giving yourself a little bit of time, and it's okay not to find every word you're looking for. I
Mhm.
often say, what's that thing, that thingamajig? And that's okay. That's part of being a normal human.
Yes, yeah, I think that's good to remember. Heather is asking, I am 3.5 years post-concussion and cannot return to work. I have cognitive issues, visual dysfunction, nausea, headaches, and right eye pressure. I have never had an MRI of my head. Would you suggest getting one now, or is it too late?
Well, I'm not the best person to ask medical questions for because I'm not a medical doctor, but I'd say in general, people who have persisting concussion symptoms that are neurological in nature, and so those are neurological symptoms you're describing, I think it would be reasonable for your healthcare provider to order some sort of brain imaging, whether it's a CT scan or an MRI. I think that those could be reasonable reasons, and it could be possible they'd identify some sort of medical explanation for those symptoms, or it is possible that those are lingering symptoms that wouldn't show up as being positive on the MRI. But I think it would be a reasonable conversation to have with one of your healthcare providers for sure.
Mhm. Yeah. Zoe is asking, is there any research about cognitively demanding tasks triggering symptoms post-concussion? So things like headache, nausea. For me, it doesn't feel like these cognitive skills are more challenging, but they lead to symptoms. Any
Yeah.
research why this may occur?
Yeah, that's a great question. And so one of the ways we think about that is that the brain hasn't quite healed yet, and doing these demanding cognitive activities actually fatigue our brain to the point where symptoms begin to present again. And so one model of why that's occurring is the brain is still injured. And when you ask the brain to perform at full capacity with this cognitively demanding task, it leads to symptom onset from the concussion. And Dr. Tatter and some of the fabulous healthcare providers here will say it's really important to get to know your threshold and work before you reach it so that we don't have these re kind of experiencing of these symptoms because it's uncomfortable, it's not kind of good for you. And so kind of learning our own thresholds and working to them so that we don't exert ourselves cognitively to a point that brings on symptoms. So to give a sports analogy, if I was an athlete, it would be, I don't just start running a marathon. I would kind of try to push myself to do 1 kilometer and then maybe 2 kilometers and then maybe 3 kilometers. But if I started to have really bad symptoms of muscle fatigue or loss of breath, I would kind of try to pull back so that I'm not pushing myself to the point where maybe I pass out. And so with the cognition, we want to use it as an indicator of how well our brain is healing, because when we're feeling good, we're able to exert our cognitive skills really without much limit, except if we feel tired from a long period of cognitive exertion. If that's bringing symptoms back on, I think it's important information to feed back into ourselves so that we can try to modulate our environment.
Great, excellent, thank you. Michelle is asking, I think she's asking, why is neuropsychological testing not covered? So I assume probably the question is, why can't you get a covered neuropsychological assessment
Yes.
covered by OPEB,
Yes.
Ontario?
So back in the day, we used to have psychological services that were more in hospitals, but with various budget costs, psychologists have been kind of they're viewed as more of a luxury service as opposed to a necessity, the way a physician is or a nurse is. And so sadly, psychology is less and less common in Canadian hospitals. But in American hospitals, you see psychologists side by side physicians because both are covered by insurance. And so it's a really unfortunate part of our medical insurance kind of coverage, in my opinion, that only through some surgical and medical programs at various hospitals you can find people like Dr. Rattan or myself. And so I wish it was different, and you can write your MPP about it, but it has to do with the funding of healthcare. The same way I think physiotherapists can be wonderful, and osteopaths, and all of these other professionals can share their knowledge. And if they were in the hospital, you'd have easier access to them. I think it is a shame, because I think we can be really helpful for a lot of people.
Great, thank you. Let's see here. Another MRI question. Would MRI results that say abnormal foci of white matter T2 hyperintensity be a reason for having difficulty thinking, or is that a separate issue?
So they're not necessarily. You could have white matter hyperintensities from white matter disease. So for instance, people who have vascular risk factors can sometimes have hyperintensities in their white matter. So it doesn't tell us about the etiology or the cause, but of course it can be correlated with difficulty with thinking. So if someone were to talk to their physician and kind of express concerns about cognition, and they do an MRI, and the MRI shows that there's these white matter hyperintensities, that could be the explanation, but it's not necessarily diagnostic in and of itself.
Great, thank you. Okay, we have a question from Yannicka. It's a bit of a long one.
Okay.
How does the measuring account for the amount of mental energy required and put up to solve these tasks, even if I get the answers all right? I experience severe neurofatigue afterwards. It is extremely taxing now, and I was mentally super fit and agile. I never even knew or considered one could run out of brain battery charge before the concussion. I guess very strong baseline would be the right term, as you just noted. And the second part for question, where does the charge of my brain battery come from? What is it physically? If you can explain this, please.
Yeah, so that's a great question. And we can talk to you about your symptoms and get a sense of the number of concussion symptoms or the degree to which you self-report fatigue, but there is no kind of objective measure of brain fatigue. So that would be something you self-report. And I would say that we've had clients in our clinic who are so mentally fatigued from testing, they have to sleep in our clinic, and before they feel mentally fit enough to drive home or take the TTC home. So I'm empathic, I understand it, and it is a major struggle, the cognitive fatigue and lack of stamina. And so I would say the analogy for understanding where the charge for our brain kind of energy comes from is very similar to our muscles. So things like sleep are really important for how strong you feel the next day. Things like nutrition are really important for how strong you feel. Things like mental wellness, like if you're feeling kind of relaxed and calm and in a relatively good mood, you tend to feel more muscular energy and kind of feeling good. So things like proper diet, lifestyle, those are things that are associated with physical health, like in your muscles. And our brain is a type of organ in our body that is very similar to our muscles. When it's well nourished and well rested, it can perform better. So I would encourage people to think about lifestyle factors that help support brain health.
Great, thank you very much. And just kind of following on that, Judy is asking, how do you determine if a person has a high baseline?
That is a great question. So some of the things that are associated with Having a high baseline would be lots of years of education. So people who go on to do bachelor's degrees, master's degrees, that could be an example of someone who's got a high baseline, because we know education is very highly correlated with thinking skills. Another example is vocation. So there are certain professions where you are thinking and you have to be mentally agile, and what you're doing seems very cognitively demanding. Another is self-report. And so we will talk to people and we'll say, well, what do you like to do in your free time? And if someone says, well, I'm a really tremendous reader. And for me, I'm already thinking to myself, someone who's reading very challenging books and going to talks and is interested in intellectual things, that person might have a high baseline capacity. And then in their interview, they say, well, I'm not having access to some of those things anymore. I'm having trouble with my thinking skills. I'd say, well, that sounds like someone who's had a high baseline who's noticing a change. And so I think the clinical interview is really important. I don't just go based on demographic factors like things I read about in people's charts, but rather talking to people and finding out what they've noticed in their life. But some of the factors, just to summarize, would be education, their vocation, and what they like to do in their free time.
Great, thank you. Christina asks, she says, my husband suffered a moderate TBI, traumatic brain
Mhm.
injury, over 10 years ago. His memory continues to decline. He has no short-term memory. He also struggles with constant fatigue. Is there anything I can do to help him with his memory and strengthen his word-finding difficulties? His injuries were on the frontal and occipital lobe.
Mhm. Well, I think that there are different healthcare providers who can be helpful for your husband. So I think some types of fatigue can have medical explanations, and some types of kind of challenges related to concussion are worthy of medical investigation. So, for instance, there can be kind of medical treatments for certain parts of concussion. I think of examples like vestibular therapies for people who are having trouble with balance. I think of treatments for headaches for people who are having migraines. I think of particular types of chiropractic manipulation. So there are sometimes medical treatments for the kind of lingering symptoms of persistent concussion. But thinking outside the medical model, I think that encouraging people to use their thinking skills in a way that's productive. So I encourage people to do learning activities. So things like going to a museum or practicing learning a new technique or instrument or procedure, some type of learning, whether it's learning a new dance or learning about a new thing. I think that can be really helpful for your thinking skills because you're practicing learning. And then I encourage them to try to teach or train someone else in what they've learned. So I think using our thinking skills can be really helpful for getting our thinking going. So I think that comes to mind as a general kind of piece of advice. Anything else that comes to your mind, Leslie?
Well, one thing would just be physical exercise. You may have mentioned that if I missed that,
Yeah,
but we
yeah,
know that just movement and certainly regular daily physical exercise is one of the best things you can do for your brain. So if
absolutely.
he's not already doing that, that
Yep,
might be helpful as well.
yeah, great
So,
suggestion.
okay. Okay, that's a repeat. Brenda asks, my question revolves around viral concussion. Can you speak to that at all? I have all the symptoms of persistent concussion syndrome from contracting COVID-19 way back in December 2020. Also, can this condition heal?
Okay, so that brings us into a whole other side of our work. So Dr. Rutan and I both have some experience working with people with persistent symptoms of COVID-19, and we're learning about it and we're doing a research study to help better understand it. But some people are reporting that they don't feel mentally like they're recovering after COVID, and they're reporting some lingering symptoms that do have overlap with persistent concussion syndrome. And so that is something that people are noticing. And I think some of the recommendations that we've shared with you, things like wellness and kind of investigating from a medical perspective, if there's a possible explanation, I think some of those things are helpful. But we don't know why some people are having poor recovery and have what are sometimes called long COVID or persistent kind of mental experiences like brain fog or difficulty concentrating. So we're still trying to better understand it, but we do know that there are similarities in the symptoms that people are noticing with persistent concussion.
Absolutely. Okay, thank you. Mel is asking, who and how can I book this assessment? So I guess how could she get a
Mhm.
neuropsychological assessment?
Yeah,
We had a
well,
couple of those. Another person had asked, how do we get an appointment to see you?
sure. So in the hospital, most of the concussion referrals come from the concussion physician, so Dr. Tartaglia and Dr. Tatter. And so when they are doing kind of their assessment of someone and they think my services could be helpful, they'll send a referral. And that's the way most people access me in the hospital is through the primary assessment with one of the concussion physicians, and they'll do a referral internally to our clinic here.
Great, thank you. Lynn asks, how do you recover processing issues? I get overwhelmed with multiple sensory situations on the street with noise, movement, light, etc.
Mhm. Well, I think that, I draw on some knowledge about autism and kind of how to work with sensory overwhelm. And one of the things that I've seen in that population that works well is to reduce the amount of sensory overload, because I don't think anyone does well when their senses are telling them this is chaos, too much is happening. And so I don't think people kind of perform well when they're exposed to a situation where they feel overwhelming amount of distress. And so my suggestion is to try to choose your environments that work well with your sensory challenges, and then over time to gradually be able to introduce more and more challenging environments, but not to the point where it brings on symptoms. And so I think over time one can push themselves gradually and subtly without bringing on symptoms. But the best way to deal with a sensory overload issue is to do some sort of sensory modification. So if, let's say, someone has sensitivity to noise, I recommend noise canceling headphones. And then maybe over time, gradually, they start to use maybe just the earphones that people use. And then gradually, maybe they're able to start to tolerate more noises.
Great, thank you. Our next comment question, I've only ever had biased, and then in brackets, insurance or workers' compensation ordered neuropsych assessments without any recommendations for my progress. I obtained a copy. Can someone help interpret the results for me? Can you also give some general recommendations of what to do to regain more of my brain's previous abilities?
Mhm. So great question, and I'm glad you have a copy of your report. You can share that with other members of your healthcare team. So for instance, if you have a family physician following you or a neurologist, they might say, well, this is a snapshot of how you were doing at a particular time. And based on this, I have this and this recommendation. So they might have recommendations for you. So I'd encourage you to share that with your healthcare team. And, I have had some people who have had insurance kind of assessments who say, that was 3, 4 years ago. I want to see if I've improved. And I'm able to look at those results and kind of use that as one point in time and compare them to the present time to say, to what degree do we see recovery in different elements of cognition? So I think it can be useful to share with your healthcare team to understand if things are staying the same, so recovery is stagnant, or if things are progressing, and so you're kind of showing more cognitive recovery from brain injury, and to be able to have a better sense of that.
Okay, thank you.
Oh, and you asked what else could you do? And I think some of the similar points of feedback about things that are good for your body and brain are lifestyle things like nutritious diet, proper sleep, mental wellness, mindfulness-based activities, physical exercise. Those are all things that are really good for brain health. And then I'd add in there, to the best you can tolerate, some sort of thinking activity that involves learning as well as teaching that to someone else. So things like learning an instrument or learning a dance or learning about art at a gallery. Those are all good for your brain.
Great, thank you. Carrie asks, my son's concussion was March 2021. He had severe vision and balance issues. After 8 months of vision and vestibular therapy, he seemed to do better, but his cognitive issues, migraines, and memory concerns began to escalate, which he is struggling with more now than he was immediately post-concussion. Any thoughts on why that might be?
Yeah, so sometimes we see nonlinear patterns of recovery where right after a concussion, we see a very few symptoms, but maybe 4 months later, we see symptoms getting worse or exacerbated. So it's not uncommon. It's not necessarily a concern that you need to hit the emergency button for, but I think it is worth discussing because we would describe that probably as persistent concussion syndrome or some sort of barriers that are preventing normal recovery or not promoting recovery. So I think it's important to try to work with your healthcare provider to find out, is there something modifiable that we could be doing to help promote recovery? And unfortunately, as we've seen with famous athletes, someone like Sidney Crosby comes to mind, that even, one of the best athletes in the world had, something like 16 months of post-concussion syndromes, despite their best efforts to overcome them. So sometimes it's a matter of time where the brain does need extra time to heal. And other times there could be some medical interventions like treatment with vision therapy or migraine therapy or vestibular therapy that helps the whole brain recover and prevent symptom exacerbation.
Great, thank you. Kyle is asking, what is the utility of brief cognitive screening tests? So for example, the MOCA in people with a concussion.
That's a great question. And so sometimes we can't afford to do a full neuropsych. I've heard from the audience that they wish they had access to it. And so it's a way that a family doctor or a neurologist can do just a brief check-in about cognition and see if there's anything really concerning. So for instance, if someone struggles with a task that they're unable to do and it raises concern in that provider's mind. So it's a good way of screening for kind of more basic challenges. And so I'd say under those circumstances, it's a way of identifying who might really need neuropsych versus just someone's judgment. So they are useful, but sometimes they don't reveal the problem. So sometimes they're not sensitive to the type of challenges you're reporting. And so sometimes they can underestimate the difficulty that someone's having, especially if you have a high baseline.
Great, thank you. Can you talk about headaches following a concussion? I have 4 to 5 migraines per month since my MTBI and wonder if this is likely to change.
Once again, it's a medical question. There are headache clinics. So there's 5 headache clinics that I know about in Toronto. And if you Google them, you could see that there's headache clinics even associated with some of the downtown hospitals. But I know that the experience of headache can impact thinking skills. So if I have a headache, I know I'm not able to speak to you the way I am tonight, where I'm really thinking about questions and looking at a screen. So I'm sensitive to that. And I would say that that's not great for your quality of life to be experiencing that degree of headache. And I would encourage you to talk to your healthcare provider, try to get to the bottom of it, see if there's a treatment or a medication that could be helpful, because I'm sure that that is not fun, to put it lightly.
Yeah, absolutely. Thank you. John asks, how do you address the cognitive dysfunction of concussion that are not necessarily secondary to other causes? So for example, secondary to headache, insomnia, depression.
Mhm.
And so on.
Yeah, so is the question, how do we address it? Like, is there treatment options? I would say oftentimes there's not. So if you know someone who's had a stroke, or if you know someone who's had some sort of neurological event, it's very hard to reverse a neurological event. And so some types of neurological changes are more stable or permanent over time. And we hope that people with concussions do not have those, but some are. And so just like a stroke where there is damage to particular neurons in the brain, we see some degree of recovery, and sometimes we don't see complete recovery. So it is possible that primary damage to neurons is not recovering, and we see an incomplete recovery or a partial recovery, and that is unfortunately just a reality. And we'd encourage in that situation where someone is having difficulty that seems more permanent or stable, to be working on strategies to help them get around that difficulty, or to be doing things differently that helps them compensate for an area of weakness with other areas that are stronger. And so if you have a weak muscle in your body, we would say, well, can you use another muscle to help you compensate for that weaker part of the body?
Great, thank you. I am aware of the time. We've had a ton of questions. I think I'll sneak one more in.
Sure.
From Leslie, great presentation. I am a concussed individual without secondary factors. Could you comment on, do brain games assist in rebuilding thinking networks? For example, lumosity.
Yeah, so it's a great question. And I would say that those types of games are things you get better at if you practice them. So just like playing Nintendo or playing other video games, you'll get better at the game, but there's yet to be research that shows that that helps you with thinking in other parts of your life. So I'd say they're not harmful. There's no kind of risk associated with them, but they're not more beneficial than, for instance, practicing learning by signing up for a new skill, or by reading, or joining a book club. So I think those are good ways to help get your thinking skills back and going, because they're more things you'll enjoy and maybe apply to your life. But I would say there's no harm to it either. And for those who don't have kind of subscriptions to brain games, I don't think that you're missing anything. I think the best way to kind of rehabilitate your thinking skills is to gradually use them, and to try to challenge yourself with cognitively stimulating activities that involve learning, and kind of teaching that to other people, as well as doing things that are cognitively demanding without reintroducing symptoms.
Okay, great. Thanks so much. Unfortunately, I think I'm going to have to cut it off. There are so many questions. Just for those of you that didn't get your questions answered, our next session is in 2 weeks. We have another neuropsychologist with us, Dr. Robin Green. So you could also come back and ask her those questions as well. But thank you so much, Dr. Gould. That was an excellent presentation. Really appreciate you presenting and answering all of these questions. Yes, just a reminder that we will be sending everyone a very short survey. It just takes a minute or two to fill out. So we really appreciate any feedback, suggestions that you may have for us to help us with future sessions. So with that, thanks so much, everyone, and have a good night.